Thank you, Mike. Mike, that was awesome music as always. So many of us here, most of us here in this part of the world, we're familiar with terms of like AIDS, Ebola fever that happen overseas. And of course, we've no stranger to our own epidemics, pandemics, I guess the correct word is. And tonight I have with me Dr. James Ayukekbong. Originally hails from Cameroon, but now makes his home here in Nanaimo. And Dr. Ayukekbong is an epidemiologist, and he's going to talk to us about this. Dr. Ayukekbong, welcome to the show.
Thank you very much. It's my pleasure, Luis.
Thank you for joining me. Yeah. So a lot of people will probably be wondering right about now, what is an epidemiologist? What does an epidemiologist do? Can you explain that to us?
Yeah, so epidemiology basically is the study of the distribution and determinants of health problems and the application in the control of health-related conditions. So there are three components here: the distribution, the determinants, and everything tied down to the control of the health problem. That's epidemiology.
What inspired you to become an epidemiologist, James, if you don't mind me asking?
Yeah, so when I was growing up, I had a passion to be able to help people who are sick, right? I studied medical lab science. And here I was working as a laboratory scientist, actually identifying or diagnosing infections. But I wasn't satisfied. I wanted to look at a bigger picture. How can I be supportive, or how can I contribute to disease control at the population level? So that's when I got interested in epidemiology, because it's actually a branch of public health that looks at disease control from a population perspective.
Well, we have some slides of you showing you at work overseas in places such as the Democratic Republic of Congo, and perhaps we could have a look at them, and we could talk a little bit about what we're seeing. Here you're addressing a group of people, I see.
Yeah, so there was a USAID-funded project meeting in Brussels, Germany on the 9th of January 2018, and I was invited to give a talk on how we can help governments to respond to outbreak investigation. So as epidemiologists, when there is an outbreak, there are three things that we're interested in. First, what is the cause of the outbreak? What is the origin of it? And then how can we control and prevent the outbreak? And during the control effort, we look at also three concepts. PPT, that is the place where it's happening, the people who are involved, and the time. Those three components are very important in response efforts.
So do we have anything to worry about? Like we've had our own, SARS and bird flu and things like that. Do we have, is there anything that we need to worry about in the field of viruses that might be endangering us?
Yes, I think the World Health Organization and other health bodies need to worry about outbreaks and the next pandemic, and for four main reasons. One, there is climate change. There is increased population growth. What we expect to see is that the population of the world will double by the next century. We're at 7.6 billion now, so we expect this population to double in the next century. And there is global trade. There is global travel. So what is going to happen is that disease ecology is going to change. Like, let's take the case of Zika virus. Zika was a virus that was discovered in 1947 in Uganda in the Zika forest. And it was limited in tropical Africa and some parts of Asia. But what we see now is a case where the vector has spread to other regions. Like we had an outbreak in 2016 in the Americas. So yeah, indeed, with the change in disease ecology, we have to be worried about the next pandemic or the next outbreak of emerging infectious diseases. Yeah.
You founded your own company called EpiTech. Could you talk briefly a little bit about what it does?
Yeah, so EpiTech comes from the word epidemiology. So we are a public health consulting firm, and we have four main practice areas. The first is we support the federal government to provide public health referrals. We also work with universities and hospitals in Canada to help to link them to Africa where they can get exposure to tropical medicine to improve on tropical medicine practice in Canada. We do research as well as we do project management within health-related fields.
Well, Doctor, I really want to thank you for joining us. It's been an honor to meet you, and thank you for sharing about your work. And I see you've got one of your hats here.
Yeah, this is a hat from EpiTech, and I'm privileged to provide this as a summer gift for you.
Dr. I shall wear it with honor. Thanks, Doctor.
Thank you very much.